Hi, my name is Dr. Ravi Gada, and today I'd like to talk about what to expect when you schedule an appointment with an infertility specialist. So first of all, how do you schedule an appointment with an infertility specialist? There's really two ways. One is you can have your OBGYN send a referral or your family practice doctor. The other option is to call our office directly to schedule an appointment. You don't always have to have a referral to schedule and meet with a fertility specialist. Once you have an appointment scheduled with a fertility doctor, we typically will meet with you in the office. Most women come with their husbands or spouses, but that's not required. Once you meet with us, we usually go over your history, learn about any prior pregnancies that you may have had, go over any fertility treatments you've had, understand your gynecologic history as well as your menstrual cycles, and any past medical history or any surgeries that you've had. Once we get a basic understanding of your medical health as well as your reproductive health, then we help formulate a plan or a workup. Generally speaking, that workup includes laboratory studies or blood work. We also typically will do an ultrasound to look at the uterus and the ovaries. We also like to order a semen analysis for your husbands so that we can see where the sperm counts, mobility are at. And any other test that needs to be done, for example, checking to see if your fallopian tubes are open, that's known as an HSG or hysterosalpingogram. And once we kind of decide what workup needs to be done, we review what all does that entail. And interestingly, most patients don't realize, but this can be even covered by your insurance. Your initial consultation and your workup, most of the time, is covered by your insurance at your regular copay. Once we formulate a workup and a plan, then we typically, as that's being done, we start looking at what could be going on. Is it the ovaries that might be causing you problems? Is it the eggs, the sperm counts, or the fallopian tubes? Those are generally the three major categories, although there are other also possible causes for infertility. And begin to come up with a plan or treatment options. And so one thing that I always like to tell patients is just because you meet with a fertility specialist doesn't mean you have to start an extensive workup or fertility treatments, but at least you can start learning your options. And in terms of fertility treatments, once your workup has been completed, then we sit down and go over whether that's fertility medications, which could be as simple as Clomid or Femara, inseminations, which we refer to as IUIs, or IVF, or better known as in vitro or in vitro fertilization, and really formulate a plan that works best for you. But one of the most important things to us in our practice is that we don't really offer everybody the same treatment. It's very individualized based on you, your partner, the workup that's been completed, your history, and your personal wishes and desires, and we really offer individualized, compassionate care towards every couple. So if you're thinking about scheduling a consultation with a fertility specialist, or you've been trying to get pregnant for the last 12 months or even 6 months without success, it's as easy as picking up the phone, calling our office. The front desk staff will give you the available times, go over your insurance information with you, and really the sooner you see a fertility specialist, sometimes the better.